Hello, and welcome to session 2 of the series Nurturing the Body, Mindfulness and Meditation for Physical Healing. Thank you for joining me again today. In our previous session, I discussed the importance of having a clear why for participating in our meditation series, and I encouraged you to jot down some insights about your reasons to meditate, as well as about how you were feeling. We then practiced a brief body scan for about 15 minutes. If you practice this for the past several days, you may have noticed that it's getting a little easier to focus on the body sensations, and also that the body feels a bit different from one day to the next. And that is really great and important information. This is where this type of mindfulness practice can function as preventative medicine. Let's say one morning you wake up and practice the body scan, and you become aware that your neck feels tighter than usual. You might then remember that you were stressed about something at work the day before, and that you tend to hike up your shoulders and clench your jaws when you get stressed. You might then choose to spend a few minutes doing some gentle stretching exercises during your warm morning shower, and that way lessen the muscle tension and prevent it from getting worse and possibly ruining your day. Also, you may decide that the next time you find yourself in a stressful situation, you're going to keep some awareness with your body. And as you become aware of your muscles tensing up, you might try to relax them right there and then, perhaps by taking a deep breath. And that brings us to today's topic, the power of breathing. I am known for telling my patients that if I could only teach them two things, it would be how to meditate and how to breathe, because both have enormous health benefits and the potential to change our life. Before we continue, why don't you take 3 long, slow breaths, ideally through your nose, and each time as you breathe out, allow yourself to release any tension from your body. And at the end of the third breath, allow your breath to resume its natural pace. Did that feel good? Do you feel a little more relaxed? So, of course, the main function of breathing is to take in oxygen, which we know is essential for our survival, and to let go of the waste product of carbon dioxide. Did you know that the average adult takes about 12 to 20 breaths per minute? If we take the average of that, which is 16, we breathe 960 times per hour and 23,000 times per day. Mind-boggling, right? If we have a good breathing pattern, we can be more efficient in the process of taking in oxygen and releasing the carbon dioxide. Have you ever noticed that you breathe faster when you're stressed? Well, interestingly, if we purposely breathe faster, we can also stress the nervous system. We actually activate the stress or fight-flight system. And the opposite is true as well. We can purposely calm our breathing in order to create a calmer state of mind and a more relaxed body. When we practice calm breathing, we activate what's called the rest and digest system. And even a minute of calm breathing can make a significant difference in our stress level and can help us feel calmer. And when we regularly practice calm breathing, we can gradually change our natural breathing pattern. And this in turn can help reduce anxiety, improve focus, create better sleep, less muscle tension, and even better digestion. And if we are healing from an injury, then activating that rest and digest system also creates a healing environment in our body, so our tissues can heal with more ease than when we are stressed out. When I help my patients practice optimal breathing, they often experience an immediate change in how they feel. It's easy, it's free, and you can do it anytime and anywhere. So let's practice some mindful breathing and diaphragmatic breathing today. So again, get comfortable. And these exercises can truly be done in any position, but I'd say for practicing purposes, probably it's best for you to either lie down in a comfortable position or sit up in a very comfortable chair, or if you like sitting on the floor cross-legged, of course you can do that as well. So get yourself comfortable, turn off any electronics that could disturb you. And then go ahead and become aware of how you're feeling at this moment. Your eyes at this point can be open or closed. Just notice how you're feeling. State of your mind, the state of your body, and then we're going to focus on the state of the breath. If you find it helpful, you could bring a hand to your belly and the other hand on your chest. And notice, as you allow your breath to happen spontaneously, what the pattern of your breathing is right now. Are you breathing through your nose or through your mouth? What are the movements in your torso that are created by your breathing? Can you feel any expansion? Your chest, your belly, perhaps even your back as you're breathing in? And then can you feel contraction as you're breathing out? And what is the quality of your breathing? Is your breathing fast? Is your breathing slow? Is it regular or irregular? It's completely normal for your breathing rhythm to change when you start paying attention to it. Or if now and then you just feel a strong urge to take a long, deep breath in between. Where do you feel the movements? What's happening in the abdomen as you're breathing in versus breathing out? And how about the ribs? The side ribs? Do you feel any movement there? How about the chest? And for the next minute, can you simply rest your awareness with your breath, noticing the air moving in, noticing the movements that happen as a result, and then becoming aware of the air moving out. See if you can keep your awareness with your breath for about a minute, and I'll keep track of the time. When your mind starts wandering, simply gently bring it back to your breathing. Keeping the awareness with the sensations of breathing. And then allow yourself to take a deeper breath in, and then letting go, perhaps with a sigh. If your hands are still on your chest and your belly, just remove them from there for a moment and allow them to rest. So this was the mindful breathing practice, simply noticing what the breath feels like and what happens in the body during the breathing. This next exercise is called Diaphragmatic Breathing. And now I'm going to give you some more cues as to how to breathe. It's kind of silly, isn't it, that we need to learn sometimes how to breathe correctly. Small animals, small children, even larger animals often know how to breathe automatically. But somehow when we get stressed and uptight, we often start tensing our body and we no longer know how to breathe correctly. A lot of my patients actually breathe exactly the opposite of the correct breathing pattern. So again, you can place a hand on your abdomen and on your chest if you like, or both hands on the abdomen. And now notice that when you're breathing in, ideally through your nose, that there is some rising of your relaxed abdomen. And then as you're breathing out, that the abdomen sinks back down. Can you feel that? So as you're breathing in, you allow your belly to be relaxed. And that way, when the belly is relaxed, the respiratory diaphragm at the bottom of our lungs gets to expand, and the contents of our abdomen get to be pushed forward a bit. So that's why it seems like our belly is expanding as we're breathing in. So as we breathe in, allowing the abdomen to rise, and as we breathe out, allowing the abdomen to fall, to sink in. And then now placing your hands over your side ribs, just above your waist. And then notice when you're breathing in, can you allow those ribs to expand sideways like bucket handles into your hands? And as we're breathing out, allowing those bucket handles to fall back down. And then now let's focus on combining those. In yoga, we talk about the three-part breath. During the in-breath, the first part is the rising of the abdomen. The second part is the expanding of those side ribs. And the third part, if we're taking a deep breath, is a little bit of lifting of the chest. Let's practice 3 of those breaths. Breathing in through the nose, expanding the belly, expanding the side ribs, and a little bit of lifting of the chest, and then a complete out breath, chest, ribs, and abdomen drawing in. And your second breath. And then breathing out again, calm out breath. And really you decide your pace. And at the end of the third breath, allow your breath to resume its natural pace and its natural strategy, its natural pattern. And notice if there perhaps is a bit of a change in how that feels. Is it perhaps easier to breathe after purposely working on relaxing the belly and allowing those ribs to expand? And our last practice is a paced breathing practice. What we know from research is that when people breathe at a pace of approximately 5 seconds in and 5 seconds out, that they experience a calming effect. Now, of course, we are all starting at a bit of a different starting point, so some of us will count a little faster and some of us will be counting a little slower. I will be counting real seconds when I count to 5, and you decide if this is the right pace for you or not. So place your hands and arms wherever you like. Make sure your position is comfortable, and at this time you might choose to close your eyes if they weren't closed already. We'll practice this for 3 minutes. So I'm going to encourage you to breathe in for a count of 5, 4, 3, 2, 1, and out. 2, 3, 4, 5, and in. 2, 3, 4, 5, and out. 2, 3, 4, 5, and in. 2, 3, 4, 5, and out. 2, 3, 4, 5, and in. 2, 3, 4, 5, and out. 2, 3, 4, 5. Now continue on your own. Perhaps exactly that pace, or perhaps you change it a little bit, perhaps a little slower or a little faster. Choose what's comfortable for you. Ideally breathing in and out through the nose. Ideally allowing the belly to rise during the in-breath and fall back down during the out-breath. And with each out-breath, allowing yourself to relax a little more. And we will practice this for 1 more minute in silence. Anytime your mind starts wandering, simply bring it back to your practice of paced breathing. And now allow your breath to resume its natural pace and notice how you feel. What changed with this breathing practice? How is your state of mind? What's the state of your body? Do you feel a bit more relaxed after this practice? How's your breath? Then go ahead and bring some movement in your fingers and your toes, maybe making a fist and spreading your fingers a few times, maybe circling your ankles. Maybe allow yourself to do some yawning and stretching out as if you're waking up from a nap. And then take a few more moments to yourself before you get up and get back to your day. Thank you so much for practicing with me, and I'll see you back for session 3.